How are brain metastases treated? Well, we should draw a distinction between two main types of brain metastases. Those within the solid parts of your brain, which are called parenchymal brain metastases, and they're the most common types, where you can actually see a lump on the scan. And brain metastases where it's in the fluid around the brain. And there, this is a moving target. That's called leptomeningeal disease. It kind of lines the surface and the little corrugations on the surface of your brain, and often presents with much more diffuse symptoms, if at all. For both types of brain metastases, the first question is, do you know what's driving the cancer? Is there a specific mutation or gene rearrangement or other molecular change that you can identify that says you're likely to have activity from a specific targeted therapy in your body? And many of those treatments now also have activity in the brain, such that you may be able to just start treatment with a pill. ALK, ROS1, EGFR all fall into that category. If you have something that doesn't meet those criteria, it's not that the treatment won't get into the brain, but the chances of it working in the brain are less, and so it's debatable as to whether you should put all of your hopes on the drug-based treatment or whether you should have radiotherapy first and just watch it. In terms of brain radiotherapy, there's whole brain radiotherapy, where literally you treat the whole brain, and then there's focused radiotherapy, or what's called stereotactic radiosurgery. Sometimes neurosurgeons will go in and resect a deposit in the brain, usually if it's large or it's likely to cause a lot of symptoms and you need fairly rapid relief. Sometimes radiotherapy is given to the resection cavity afterwards, so it's usually not just done in isolation.